So now when we look at non-autologous stem cells, so these are stem cells that don't come from your body, you know, in the past this was a problem. Now we have newer technologies where we can actually get stem cells that don't come from your body, and they're immunoprivileged, which means that you don't get an immunologic response, or at least in theory. There's a few different companies out there and a few different technologies out there. And I'll sort of give you, I won't tell you about names of different companies, but I'll just give you the pluses and minuses. So again, you do your own research, right? So non-autologous pros and cons. The pros are you can get high concentrations, sometimes millions of cells per cc. You can get epigenetically young cells, which means that these are cells that are literally a few months old versus many decades old, which is the case in many patients, right? 30, 40, 50, 70, 80 years old, you know, versus a few months old. So those cells, almost 100% of them should be active, or a very high percentage should be active, whereas when we turn 70, 80 years old, the thought is that maybe less than 10% of those cells are actually active, you know, and so you see a big drop-off. So you may have 1 million cells, but only 100,000 might be active, whereas here you may have 1 million cells and maybe 950,000 are active. It's quick, it's easy, it's reproducible. You have, obviously, you can get them from multiple different sources. There's no surgery involved, so the costs sometimes are lower, and there's no known complications as of now. Cons: potential bacteria, potential viruses, logistical issues. You know, handling these products have to be stored at -200 degrees Celsius, not Fahrenheit. So this is pretty darn cold. So it's not something you want to stick your hand into, because it will be gone within a second. So they have to be stored very cold. There's a little cost involved in that. There's some logistical and training issues with those non-autologous stem cells. So some non-autologous products, umbilical cord derived stem cells are available. Umbilical cord tissue matrices are available. So those are matrices of different growth factors. There's amniotic liquid suspension that have, again, different proteins and growth factors. And then there's amniotic membrane. And the amniotic membrane itself is used for a lot of burns, wound management. So this is actual thin membrane that actually sits on top of, you know, some type of injury or wound. And I'm not going to get, this is the last I'm going to talk about the membrane, because we don't use that you know, for our purposes in typical pain management. But the results can be quite dramatic, you know, with amniotic membrane. So the three things that we would probably end up using are umbilical cord derived stem cells, umbilical cord, and amniotic membrane matrices. And we personally don't use amniotic liquid. There's a lot of disadvantages to that, but some places do. Just know that when we look at amniotic liquid suspension, as well as these umbilical cord and amniotic membrane tissue matrices, there are no stem cells in them, okay? And I'll repeat that, because this is a huge point. You're going to see, mark my words, over the next few years, you're going to see stem cell clinics popping up left and right, okay? Everyone and their brother is going to do it, and they already are starting to do that. And there's a few of them that advertise quite heavily. And a lot of them are using these things that contain 0 stem cells, but they advertise that those are stem cells. To me, that's fraud. You can call it whatever you want to. And even if there were stem cells, it undergoes something called terminal sterilization. Okay, when you get these products from donated sites, they have to sterilize them. So even if there were cells, they're killing those cells off during the sterilization. So now it may still help you, because these cytokines, growth factors, proteins may help you, just like PRP may help you. But you know, then why don't you just do PRP and save yourself thousands of dollars, right? So that's where the dishonesty comes in. So that's one thing I want to make sure you guys are aware of. Wharton's jelly is a mucous connective tissue within the umbilical cord, okay? And that jelly contains stem cells. So one of the non-autologous sources for stem cells is this Wharton's jelly. And that area, okay, that mucous connective tissue in the umbilical cord is an immunoprivileged area, which means it doesn't belong to the mom and it doesn't really belong to the baby, which is why we're able to harvest stem cells from there and potentially deploy them into other individuals without getting that immunologic response. So some of the advantages, obviously, one, again, there is no harvesting. This is coming from somewhere else, so there's no harvesting on the patient. You have about 130 million live births worldwide, so that's a huge amount of source of this Wharton's jelly and of these stem cells. Rate of proliferation is higher than other sources. It's easily collected. There really are no ethical concerns because, again, this is nothing. This is all, it's all really umbilical cord, placental tissue. It's all pretty much thrown in the garbage after a delivery. And now we have this excellent source of stem cells that we might be able to use. And they also have inherently non-tumorigenic properties. So one other question people have is, hey, will I get a tumor with these stem cells? That's not how stem cells work. We have no evidence right now that stem cells will cause tumors. It's just not how it works. So some of the benefits of mesenchymal stem cells is their ability to penetrate or migrate to areas that have inflammation. We started this conversation about inflammation, and we're sort of going to be ending it on that same note. You want them to go to these areas that are damaged and they're not healing and allow them to heal. Now, how do you get them there? You can get them there through injection. You can get them through IV infusion. Even in some patients, inhalation. So we've had some patients with lung disorders where they've inhaled stem cells and found it to be beneficial. So cryopreservation, I just want to show you a quick slide. This is a cryo freezer, and these little sticks contain the stem cells at the bottom. This is stored at negative 200 degrees Celsius. So if you guys ever have stem cells deployed and they're non-autologous stem cells, they're probably going to be stored in a freezer that looks a little like this. So umbilical cord blood, I'll quickly touch on that. It's something that's used more in the cosmetic industry than it is used in the pain management industry, where we're injecting joints or even neural tissue. So umbilical cord has stem cells. One of the biggest problems with umbilical cord is also has a lot of other things, and we're talking about the blood itself that's in the umbilical cord. You have a lot of other factors in there, and some of those factors can actually cause the reaction with with the other patient. So that's one of the problems we've seen with umbilical cord blood. Now, some of these companies are able to filter most of the blood out, but they're not able to filter all of it out. So that blood still exists in the stem cell product. And so right now we're not using that for pain management purposes, since we have umbilical cord product that has either stem cell or growth factors, and it bypasses this blood issue. So this slide's kind of just talking about that, a little comparison between the two. We're not using blood product, we're using more of a tissue product and getting cells directly from that. So we're able to avoid some of the blood reactions. And that's why we can use those products and still be immunoprivileged. So we don't see the graft versus host disease. We don't see this acute or chronic problems with the graft versus host disease because we're not introducing the immunologic cells into the patient. Amniotic membrane, okay, this is kind of a picture of what that would look like. Amniotic membrane is typically used for different wounds or injuries. It's terminally sterilized. Again, it does not have any stem cells inherent in that product. And that product is really used for burns and areas that are surgical areas or whatever that aren't healing well. Amniotic membrane can also be used not as a physical membrane, but as a product that contains growth factors, and that is something that we can use, so we can inject that product. Amniotic fluid, like I said before, is not something that we're using simply because it does not contain stem cells. It does have various growth factors, but we can get those growth factors in a much higher concentration and in a much better way through amniotic membrane or umbilical cord. But some stem cell clinics do use amniotic fluid, I believe because it is the cheapest product that you can buy, and some of them are advertising as stem cells, and it's not.